Good morning. We're back again. Dr. Jason Austin, Dr. Wendell Ray, Dr. David Hale. One of the things that we want to discuss this morning is I have a question that I'd like to pose, and it is in relation to some of the feedback or comments I've heard from the students in the program. One of the things that we discuss on a regular basis as part of the systemic approach, as part of the Bateson team, is this idea of cybernetics. And I think cybernetics is one of those issues that a lot of the students aren't quite clear on what we mean by when we say that, or is there a way to be clearer in our description of what cybernetics is. And so is what I'd like to pose today is this: what is cybernetics, and how would you respond to a question like that if a student asked you, what do you mean by cybernetics?
Well, great. I like the question, first off. In 1967, John Weakland was the editor of a special edition of the American Behavioral Scientist, April 67, volume 10, number 8, and one of the papers in it is by his mentor, Gregory Bateson. The name of the paper is Cybernetic Explanation. Those familiar with Bateson also know that a copy of that paper is in his collection, Steps to an Ecology of Mind, as well. I'm going to start to talk about cybernetics by a direct quote with Bateson, and then I'm going to follow that with some other quotes by some other members of his team in the Palo Alto group, and then later at Palo Alto after the Mental Research Institute was founded.
And we're free to ask questions during the process.
Absolutely.
Okay.
Here's the quote of Bateson. It's fairly short. Cybernetic explanation is formally described by Bateson as follows. Causal explanation is usually positive. We say that billiard ball B moved in such and such a direction because billiard ball A hit it at such and such an angle. In contrast to this, cybernetic explanation is always negative. We consider what alternative possibilities could conceivably have occurred, and then ask why, out of all the many alternatives, why of the many alternatives were not followed, so that the particular event was one of those few that could, in fact, occur. In cybernetic explanation, or cybernetic language, the course of action is said to be the subject to restraints. It is assumed that apart from such restraints, the pathways of change could be governed only by the equality of probability. In fact, the restraints upon which cybernetic explanation depends can in all cases be regarded as factors which determine an inequality of probability. From a cybernetic point of view, the role of the species in an ecosystem or the behavior of a family member in a family are all said to be negatively explained by the analysis of the restraints present. The negative form of these explanations is precisely comparable to the form of logical proof called reductio ad absurdum. Page 29, 1967. Now I want to go on and talk about this a little bit more. So cybernetics is about restraints. Cybernetics is about how, out of all the possible things someone could decide to do, they only do these very few things, and they tend to do them repeatedly. Let me go on with this. From an interactional view or a systemic approach view that was pioneered at the MRI Brief Therapy Center, that whole approach is synonymous with Bateson's cybernetic explanation. The primary focus of the work there is on the interaction between people influencing and being influenced by one another in the present moment, as distinct from the many other approaches that emphasize individuals in isolation or what is purported to be going on inside of them that motivates them. The focus of attention is what's going on right before my nose, such that I can read what happens that on your part immediately preceding and after something I might have done, or in the presence of a third or more. There's a science to that kind of observation. And then, so, from an interactional perspective, and this is another quote, this one is by Don Jackson, one of Bateson's longtime collaborators. He said, quote, "We view symptoms, defenses, character structure, and personality as terms describing an individual's typical interactions which occur in response to a particular interpersonal context, rather than as intrapsychic entities." Okay, so you're always looking at what is the context and what's the nature of the relationships of which a person is a part, and within which their behavior is, in a sense, coherent. Okay, now that shift from an individual to a relational or contextual point of view carries enormous implications for understanding behavior qua behavior. One immediate revision offered by Family Study has been the order of data that is studied. This is the big trouble that I have getting across to people. The order of data that you're looking at is a different order of data. You're looking at things that you can see transpiring in the present moment between people, almost as though they're following rules. See, as in contrast to conjecture about what must have gone on inside a person that motivated whatever the action was, and or what must be the genetic predispositions out of which this motivation, this internal motivation comes, and or some historic post-traumatic stress that somehow has shaped and has led to this behavior. Those are legitimate points of view, but they're very different orders of data. If your data are, what can I see happening between people right now? Is there a rhythm in that? And if my job is to, if I believe that to be so, then my job is to get the rhythm down and then act in such a way that the rhythm cannot continue.
So you're saying, in essence, what you see, it might be safe to assume that what you're witnessing has happened previously and will happen again. There's a
Without a
chance.
doubt.
Yeah.
But many people say if you see something happen twice, that it's a pattern. I think that you're the slow one. If it happens, period,
Yeah.
it's redundant, it's patterned. And it's just you slowpoke, that may take a dozen times to pick up on it. But it's there.
Yeah.
And this is directly theoretically germane to systems logic theory. You cannot not behave. That's a big one. And one cannot not define a relationship. If you are in the presence of someone and time passes, and a relationship will emerge. As it emerges, it is not just some willy-nilly thing. It's if you're going to look at it from cybernetic explanation perspective.
Right.
And by the way, it is only a perspective. We're not selling truth here. We're not saying this is more true than other points of view. No, we are saying, however, that you are what you eat. There are consequences to the conceptual frame you allow yourself to be aware of that you are using, and we very much strive in the program at ULM to understand a cybernetic explanation, to understand systems logic as it was laid out, principally in the Palo Alto group, but not only in the Palo Alto group. There's other people.
I'm still curious of a simpler explanation of cybernetics for someone who might be having a hard time understanding exactly what it means. You've given a quote by Gregory Bateson. You followed that up with some clear-cut, obvious examples. I'm wondering though if there's what else can you say that would be simpler? Maybe that anybody could understand.
Someone said, I either read this recently or someone told it to me. Both happened, actually. Someone pointed me to a document and I did read it, and then we discussed it. Jay Haley said in his first speech at the first Ericksonian conference in 1980, is the lecture that I'm referencing. He said that symptoms are contracts. Okay, symptoms are very provocative statement. That he said that Milton Erickson believed that symptoms are contracts. Okay, that was profound to me. I think because Haley did this quite a lot, he's talking in terms of it's as though people are in a contract with one another. It is as though people have decided that the only way they are allowed to behave with one another is such that this one particular person behaves in a way that someone then says that's symptomatic. And from a cybernetic point of view, as Bateson just described, with cybernetics being a science of restraint, how out of all the possible things one might do, is it such that one repeatedly sees people choosing only these 2 or 3 possible ways of behaving. Then, when you think about what Haley said in that statement, that begins to make sense. In their interaction with the people with whom a person lives, those interactions are structured such that the only behavior that gets reinforced or life breathed into them, it is more of the same behavior that someone then says, you see him, he's the symptomatic one. Does that help?
It does, it does.
It does.
Go ahead.
Jay Haley was no joke. He was a good writer. I recommend it.
I like the way that you just laid that out. And I have a question after teaching some master students, and some of the conversations that we've had in these classes gear around the topic of the order of data that you're speaking of. Because all master students, whenever they learn this material, it's provocative, it's fascinating, it's incredible to conceptualize human behavior in these terms with restraints. But it boils down to, is this order of data sufficient enough to treat these families? Instead, and by talking about sufficiency, looking at human behavior in this way, is this sufficient enough that we can make meaningful treatment for families? And some master students have trouble grasping how this is sufficient enough to intervene in families without considering the intrapsychic entities that people bring into the room. Can you speak a little bit about how this order of data is sufficient to bring to the table and treat families?
It's a good question. It's a complicated one, but it's a good question. So I'll give a shot
Okay.
at it. By order of data, what I mean, no, take I out of it. By order of data, what the literature, the interactional view literature, and there is a lot of it. It isn't like this is 2 or 3 items. The last time I looked at MRI, on their webpage, they have a bibliography that is then was over 600 references, and then was about 1985. So goodness knows what it is now. All right. So there's a lot of literature out there. But if you're going to look at this from the interactional point of view, then the order of data is a big deal. Is it the nature of the people in the situation interacting with one another? So that if for me to be helpful, I need to first understand what's going on inside of people that are out of which is produced this difficulty. Very legitimate point of view, intrapsychic point of view, very consonant with trauma theory, very consonant with genetic predisposition theory. And that's one point of view. And that's an order of data. Okay, what's going on inside of a person is one way of thinking. The relational point of view or systemic point of view, their primary data are what's transpiring in the moment between 2 people. That which is neither I nor thou, but is manifested in the dynamic of the moment as people interact with one another.
Okay.
And that is what they refer to when they laboriously lay out the difference between these two orders of data. Now, why would they take such an effort, they being Gregory Bateson, Don Jackson, Paul Vacevic, John Weekland, others that were of that group, to lay that out? Because how one goes about looking at a therapist, how a clinician or a therapist goes about looking at what's going on, sets the framework for what is the ethical thing to do, what are the alternatives one has available to oneself for action. You follow me?
Mhm.
And so this is why, as far as I can't see how there's anything more important than understanding the basically the differences between two different worldviews that have tremendous implications that are different in how one conducts oneself. So, to go to, is it sufficient, for instance, if I understand you correctly, there's implications unfolding from this decision or choice, or the thinking that you're making a choice. I'm relational, I'm systemic, I'm behavioral, relational. But you really should. We really need to get your blood work so that we can check and see if there's any medication that can be done to temper whatever it is physiologically that is happening, often without recognizing that when one does something like that. I'm not saying it's not something one might not find themselves doing under a certain set of circumstances, but when you do that, you've decided to attempt to intervene by quelling or increasing the physiology of an individual in a situation, with the idea that by doing that, it'll have its ramifications through the system. And I don't know how to make it more individual than to do it like that. I'm not saying it's wrong or bad. I'm saying that's one way of peeling an apple. Another way of peeling an apple, using a different set of constructs, which are exceedingly sufficient, and there's plenty of research to support the idea of a systemic point of view if utilized by someone who is trained to do it properly, right? If you look at outcome, people came with this complaint, did they or did they not leave without the complaint? Straight up simple. There are lots of data that demonstrate that the relational point of view is at least as sufficient as any other perspective. And we haven't even touched the East Coast systems people. Murray Bowen, who has his own lexicon and his own conception of Bowen's family system thinking, and Don Jackson were very, very close colleagues. They intentionally developed two alternative languages, and with Bowen, I'm not claiming to be an expert. I know something of his work. Intentionally said, I'm a psychiatrist. I'm a medical expert. I want to work within the existing frame. I want to work within and it's not me saying this. If you get Murray Bowen's book, Family Theory and Clinical Practice, I don't remember the exact page, but you give me a minute, I can find it. He says, I intentionally decided to use physiological metaphors, biological language as a way of connecting with my other colleagues in the medical field. So I look and see what Father Bowen said. Father Jackson said the exact opposite. I want to develop an alternative language because what we're looking at is an alternative frame of reference, and it is easy to get oneself unintentionally digressed into and having to deal with the implications that come from the words that we use that we don't really think about. What do they imply? And so he very intentionally, in several instances in his copious writings, talked about we need a different language, a language of interaction, a language of a here and now. And that's the primary difference, and just in terms of the words that were used on the West Coast to develop what is called interactional theory or communication theory, a la Bateson and his team, or system theory on the one hand, as in contrast to their blood relative Murray Bowen on the East Coast. And there was a time that the two primary systems logics used in family system theory were one of those two. There now are a proliferation of other people claiming to be, who have articulated systemic frames of references that in some ways are compatible to those 2 points of view, and in other ways they are not.
The idea of
That answers my question.
the idea of cybernetics, one of the things that I keep going back to is this sense that cybernetics is feedback. Cybernetics is feedback, and one of the things that as you were talking, I was thinking about how when billiard ball A hits billiard ball B, the feedback is it's going to go in a certain direction. When people are interacting, the example I use is that if you're walking, you go to the grocery store to buy milk, and as you're walking down the aisle, you have every intention of going down to the milk aisle, buying milk, and leaving the store. But as you're walking through the store, you see this real pretty display. You had no intention of buying anything, but you see this pretty display, it catches your eye. The feedback is, this is a beautiful display. Oh, look, they have cookies. I want a cookie. So the next thing you know, you buy the cookies and the milk. So so you went there with nothing in mind other than to buy milk, but the feedback of this display prompted you to make the choice to buy the cookies, when there were a million other choices you could have made, but for whatever reason at that point in time you chose to buy the cookies. Is that close to this idea of cybernetics and feedback?
Feedback is certainly one of the ideas that within there's a body of constructs that constitutes system theory. Okay, interrelated concepts. Feedback is obviously one of them. I'm not evading the question. I do want to come back to it,
Right.
but I want to say something else. Bateson in his writings, Jackson in his writings, all of them, but more than all of them being Jay Haley, John Wickland, Bill Fry, Paul Votsvik, Dick Fish. Okay, there are others, but those are the primary players in the Palo Alto group and then the MRI early years. Said consistently, we borrowed ideas from a number of different disciplines because the ideas are salient
Right.
to the
They fit.
development of a communication theory. So they would talk about von Neumann's information theory and game theory, and talk about Norbert Wiener's mathematics and the idea of some of the ideas about function that come out of mathematics, and feedback being also another, a very early idea that was developed by Rosenbluth and von Neumann and Wiener and others at MIT and other places. When they were trying to figure out, it was just before and during World War II. They were trying to make a better machine gun so that they could find a way to track something and hit the target better. And so when they were doing that research, out of it came this idea of feedback, that if the response is within this range, then I make this correction.
Right, yeah.
Right? And out of that hard science came some really important ideas, like calibration, like feedback, like I'm blanking. I would have to think, because there's plenty of others.
Right.
But that whole way of thinking was adopted whole cloth by Bateson and Jackson and the rest of the Bateson team, because it was a team.
Mhm.
They worked together from 53 to 61. And quite intentionally they did that. You know, they took from von Bertalanffy's general system thinking, a biological general system thinking concepts. So when one hears these ideas like feedback, they may have been drawn from other disciplines, other science work that was being done in the 40s and 50s and 60s, when the communication theory that then later got called interactional, that later got called systemic. No, I think it was the other way around. Communication, systemic, interactional. And on the West Coast at MRI at least, they were much more comfortable with interaction as a metaphor. Whereas with Bateson on the East Coast, he has a constructs. It's pretty straight up that his theory, like any theory, you have certain interrelated constructs that together.
You mean Bowen on the East Coast?
Who did I say?
You said Bateson.
I'm sorry,
Yeah.
I meant Bowen. Yes.
Yeah.
My bad. You know, Bowen has 8 constructs, and they were developed very rigorously over decades, and within his frame, there are 8 interrelated concepts, any one of which is not sufficient to use. That's a great word. But combined together, they make a theory. In systems thinking West Coast, it's the same thing. Feedback's one, homeostasis is another. There's a lot of specific ideas. Amongst them is what I think is, if you get past one cannot not,
Right.
which is just, oh, wow. The idea of what is now an MRI brief called the non-normative, non-pathological frame. Earlier, by the person who brought that idea into the group, Don Jackson, said it more simply. We are all doing the best. We are all doing the best we can. May I want to give this direct quote. Could you
Yes.
hold on to this? If we're going to quote somebody, let's quote him correctly.
We can cut this, we can cut this out.
No, you made us. Some people like me wandering into a book.
Well.
But absolutely we can cut it out. But hang on, let me read this to you though, because I just think that he says it better than I can say it.
Because I want
and
to,
it's less than 500
eventually
words.
I'd
So
like
no
to
one.
turn it back to this idea of cybernetics as restraint, Gregory Bateson, then it.
It's fine.
Hang on. Well, we can do it, and we can cut this into several different slices too. Listen to this. This is where this came from. And he, by the way, got it from Harry Stack Sullivan. So let's put it in Sullivan's terms. We are all much more human than otherwise. Boy, does that even the playing field?
We are all much more human than otherwise.
Be we messed up, or be we supposedly having a seamless, carefree life?
Are you sure, Wendell? Are you sure we're all much more human than otherwise?
I'm sure that Harry Sullivan said it. Let's say this. Here's how Jackson put it. Before it became non-pathological, non-normative, it seems to be difficult for most persons in our culture to give credence to the idea that the individual does the best he can at any given moment. Why would it be otherwise when all of us would rather be comfortable than in distress? The terms lazy, stubborn, no willpower are not merely descriptive, but imply moral censure and an unspoken he could do better if he wanted to. Hence, a psychiatrist is up against social prejudice when he attempts to point out that certain dynamic interpersonal processes over which the individual has no control are responsible for his character traits. That is a theoretical premise within the system's, family system's logic. And it's as important as feedback, or if I, a clinician, are looking at the situation from that point of view, that people are doing the best they can given the situation and the relationships of what they are part, I'm gonna behave differently than if I take the point of view that there's a pathology here. Pathology is a slippery slope to someone's at fault. And then the next thing you know, you might have this nasty beast called blame push itself to the surface, or people responding as though they assume that you're blaming them, and now you're off to the races. And so feedback is an exceedingly important idea, amongst other exceedingly important ideas.
How would this then, to kind of bring it back full circle, then how would this then apply to the ideas or the ideas of cybernetics as you described Gregory Bateson saying as restraints?
It's a science of restraint. If I'm an observer, I can notice what I see in the behavior that keeps repeating itself. Then I can only conjecture. In fact, this is one of Don Jackson's assessment instruments. How out of all the possible things a person could do or say, do they only do or say A, B, and C, and not D, E, and F, and G, right?
Yeah.
And the moment you think about that, then that leads to saying, well, the nature of the relationship or the context must be structured such that only those possibles are coming to the mind of this person who's doing the best they can given their situation.
Right.
Does that?
And that's cybernetics.
Absolutely, that's cybernetics.
Yeah.
That's applied cybernetics in our field of human interaction amongst intimates.
And here at ULM, we teach students how to evaluate these restraints on a system as for having a preferred way of acting in a relationship in families.
Dr. Austin, that is a whole nother 20-minute talk. I'm dead serious about that, because and it's in a big one. The idea, I'm not sure we teach. We set up, we do our best to have a frame of reference and context in which people learn, which is different from, in my mind at least, I'm gonna teach you something. It's in contrast, how can I behave in this? Again, this is a useful conversation to me. How can I behave in such a way that I increase the odds that someone will learn, not only learn, but learn what it is I'm hoping they'll learn, which is a whole nother,
Right.
Thank
Yeah.
you.